Hi everyone, I'm Dr. Jyoti Priya. I'm working as consultant nephrologist in MGM Muthoot Medical Center in Kerala. Today, I'm here on behalf of the social media team of the third National Conference of Women in Nephrology India, Win Icon 2024, which is going to be held at Thiruvananthapuram in Kerala on August 3rd and 4th, 2024. And today, we are having here a session of pre-conference interview, and we have with us none other than Dr. Annette Bruschfeld, Professor in Kidney Medicine, Linköping University. And Professor Annette will be talking on emerging biologicals and targeted treatment in ANCA vasculitis in Win Icon 2024. It's an absolute pleasure to be with you, ma'am. And we are indeed very fortunate to have you with us today and also for Win Icon 2024, which will be held at Kerala. And to begin with, could you please share your background in nephrology and what exactly inspired you towards kidney research, especially in the field of ANCA vasculitis? And in your opinion, what are the emerging areas of nephrology research? Over to you, Professor Annette.
Thank you very much for this introduction. So I am born and raised in Sweden, but I also have a French background. And I was trained in nephrology at the Karolinska University Hospital, where I also studied medicine. So for a long time, I worked there. And I also did a postdoc in the US. And very early on, I was interested in inflammatory kidney diseases, and I saw that this was an important field because how it strikes the patients and how it has long-term consequences of losing kidney function and also complications regarding transplantation. And so that was my field for a really long time. And with time, I've also become much more interested in prevention of CKD and also on a global level, which is very important. Kidney disease is a growing epidemic or almost a pandemic that will affect many people for many years to come, and there's much more that we can do. So the research part is basically didn't think about it that much at the beginning, but with time, I realized that there were many unanswered questions. And I always liked this story about this Nobel Prize laureate in physics, Isidore Rabi, who grew up in Brooklyn among all these poor boys and girls. And he said that all the mothers would ask their children, so what did you learn today at school? But his mother was different. She said, did you ask an important question today?
Thank you, ma'am. So you will be in a very special session at Win Icon 2024. So can you give us a glimpse of your talk on your topic?
Yeah. So there are many things happening in nephrology. Prevention is like a big topic, but also in inflammatory or immune-mediated kidney diseases. And in IgA nephropathy, there are many new studies, and also in ANCA vasculitis, we see emerging new treatment that may change the outcome for patients. And my talk will be about the goals of treatment, a little bit about current guidelines. And then also I want to discuss the novel therapies that are available now, or at least maybe not available in every country, but that are on the market and will eventually spread to other markets around the world. And the novel treatments that are emerging in B-cell depletion and other types of immune modulatory drugs. But I also will discuss the consequences of vasculitis, the risk of long-term outcome, and also of this new concept and how can we not only prevent inflammation, but also fibrosis that is as a result of residual or damage from the initial kidney insult.
Okay. Thank you. Thank you so much, ma'am. Looking forward to hearing from you at Win Icon 2024. So, one question is that, in your opinion, how important is international collaboration in nephrology, especially in the field of research and academic activities?
No, this is very important and essential. We need to collaborate much more. And nephrology is, after all, a fairly small specialty, and one doctor can't do everything, one researcher can't do everything. And we also need to consider the manifestations of disease, that it may vary across the world, and that we need to take into account genetic aspects, but also other socioeconomic aspects that are important for disease development.
Okay, thank you, ma'am. In our conference, we will be having several nephrology residents, young trainees, early career nephrologists. So, as a senior faculty in nephrology, what's your message or a piece of advice to these young nephrologists, as well as to the entire delegates attending this conference?
So, my experience is to never give up, to study a lot and read a lot, but also talk to and collaborate with more experienced colleagues. And even if you can't travel to other places, you can still follow all this. There's so much, so many opportunities now in with using social media. The ERA that I have been very active in has many very excellent opportunities to learn new things with e-seminars, and so are many other organizations, ISN and ASN as well. So if you can, especially as a trainee, you don't need to pay much money to be part of this. You can enjoy all this and learn a lot.
Okay, thank you. Thank you so much for being with us and taking your valuable time with us today for this pre-conference interview, and also for Win Icon 2024. We are really excited and eagerly looking forward to hearing from you at Win Icon 2024. So, viewers, please note this talk is on 3rd August 2024 at Hall A. And this talk is on emerging biologicals and targeted treatment in ANCA vasculitis, which will be from 2 to 2:30 p.m. So do register and do not miss to attend Win Icon 2024, which will be held at Thiruvananthapuram in Kerala on August 3rd and 4th, 2024. So do join us with this conference, and definitely Win Icon 2024 is going to be a great academic feast. Thank you.
Thank
Thank you,
you.
ma'am. Thank you.
Thank you.